Hello, I'm Dr. Ponnu. So today in this video, I'm going to talk about the treatment of first episode of unprovoked seizure. So what are the provocative factors for seizure? So it can be a low sugar, high sugar, low sodium, head trauma, or high grade fever. These are the general provocative factors for a seizure. So when somebody gets a seizure without any of these provocative factors, it's called an unprovoked seizure. So when someone comes to us with the first episode of unprovoked seizure, we normally do a detailed evaluation including blood test, MRI brain, EEG, etc. So when all these tests come back as normal, then what do? Do we treat the first episode of unprovoked seizure? So many times I've seen that parents and patients, they are very anxious when in some cases we do have to start on medications in first episode of unprovoked seizure, and the parents are very reluctant. They're like, the tests are normal, so why do we have to start on medicines? So there is some criteria that we follow before deciding on the treatment. So in some cases, even if all the tests come back as normal, we will have to start on a treatment for certain patients. So what is the criteria? In someone who's got their first episode of seizure at night, it's called a nocturnal seizure. It's an indication to start treatment. In somebody with a strong family history, for example, parents or sibling with strong history of seizures, this person also might get recurrent seizures. So in that case, we start on medications. Then focal seizures. So you might have seen in movies and TV, somebody gets a seizure. Somebody who gets a seizure, they move both their hands and legs. So when somebody gets a seizure, or movement of one side of the body, it's called a focal seizure. So focal seizure is an indication for starting a treatment. And somebody who works as a driver or somebody who works near a heavy machinery, all these are indications for starting treatment. Or when you examine a patient and then we find that there is something abnormal in the examination, so abnormal neurological examination is also an indication for starting treatment. Or if the first episode of seizure was a very major one or a life-threatening one, it's called a status epilepticus, whereby the seizures are prolonged, and prolonged seizures can lead to death. So if the first episode of seizure was a prolonged one, even in that case, we start on treatment. So when we start on treatment, normally we give the treatment for a period of 2 to 3 years. And by starting this treatment, the risk of recurrence in the first 2 years is reduced around 60%. If the MRI brain, EEG, or any of the blood tests are abnormal, not normal, then it's a definite indication to start treatment.